So we've looked over the management now as well. Now, no surgical talk is complete until we address the surgical complications. So we are going to look into those and stick around because there's quite a few. So like with all major surgeries, hemorrhage and infection will always be on our list. But we also have other things like pulmonary complications. Now this could include things like pneumonia, atelectasis, which means collapse of the lungs, ARDS, which is acute respiratory deficiency syndrome, and empyema, which would be presence of pus in the pleural cavity. Now, we could also have leakage from the anastomosis site. Now, anastomosis means the place where we joined the remaining esophagus to the stomach. You could have injury to the thoracic duct. Now, the thoracic duct is one of the lymphatic channels that runs through the chest. And so injury to that could result in chylothorax and chyloperitoneume. Now, diaphragmatic hernias are also a potential complication. Now, diaphragmatic hernias are, you will find the gut loops passing up into the thorax through an aperture in the diaphragm. So that's also a potential complication. Now, there's always a possibility of injury to neighboring structures like the recurrent laryngeal nerve and, of course, the aorta, which just so happens to be the biggest blood vessel in the body. And benign anastomotic strictures can develop later on. And so what that means is at the point where the joining of the remaining structures occurred, a stricture means that there will be a narrowing there. But that can, be treated using endoscopic dilatation. So you pass an endoscope through and then dilate the portion which holds that stricture. Now, everyone, that was just about esophageal carcinoma. Yes, it is on the rise and it can be really devastating. So I hope this lecture was informative and that it helps you in your exams and your clinical practice. Stay tuned to sqadia.com for more of your favorite topics. Thank you very much.